Today, I will show the results related to one intervention with Brazil nut in diabetic patients. The environment that we live in, the lifestyle we adopt, and of course our genetic information may be the risk factors for the development of the non-communicable disease. The non-communicable diseases were traditionally related to developed countries, but today it has a global importance. In 2019, 71% of all deaths globally were due to non-communicable diseases. These diseases kill 41 million people each year, and more than 15 million people die between the ages of 30 and 69 years. The four main types of non-communicable diseases are cardiovascular disease, cancers, chronic respiratory diseases, and diabetes. And these four groups of diseases account for over 80% of all premature non-communicable disease deaths. And among these chronic diseases, one that stands out is the type 2 diabetes mellitus. The type 2 diabetes is a complex multifactorial disease characterized by a persistent elevated blood glucose that occurs as a result in changes in insulin secretion and or action, leading to changes in the metabolism of carbohydrates, lipids, and proteins. And the disorder is also accompanied by a pancreatic beta cell dysfunction and a generalized loss of insulin sensitivity. Well, the chronic conditions of hyperglycemia, hyperlipidemia, and hyperinsulinemia can contribute to oxidative stress, which is involved in the progression of the disease, also contributes to the complications of the type 2 diabetes, and may react with different biomolecules, inducing oxidative damage, especially in DNA. DNA is the most sensitive biological target for damage from oxidative stress, since it is not well protected and has limited chemical stability. And DNA damage has shown to have a critical role in diseases development and progression. And in fact, there is a strong link between type 2 diabetes and the presence of DNA damage. Some studies have already shown an association between the fasting glucose levels and oxidized purines. And in addition, the glycemic control may be indicated as a determinant of overall DNA oxidation, since individuals with high levels of glycate hemoglobins present also higher levels of 8-oxo-G. And more, type 2 diabetic patients are highly predisposed to cancer. It seems that in the conditions of the type 2 diabetes, the DNA damage increases while the DNA repair system decreases. And added to this, the oxidative stress markers are increased while the antioxidant defenses are diminished, leading to the genomic instability, which is found in individuals with type 2 diabetes. And knowing this, and that there are some micronutrients that play an important role in glucose homeostasis or antioxidant protection that is required in type 2 diabetes, such as zinc, magnesium, selenium, and vitamin D, we decide to supplement diabetic patients with Brazil nut, a nut that is rich in selenium. But why selenium? Well, selenium is a trace mineral essential for human health, a key element of selenoproteins like GPX, and acts an extremely important antioxidant in different cell types. So since this mineral can combat oxidative stress, could it also aid in type 2 diabetes? And looking for these information in the literature, we found that it seems yes. And in addition, the selenium proteins have several functions that go beyond the antioxidant activity, such as the reduction of some non-communicable diseases, improvement of the immunological systems, and also participation in the maintenance of the genomic stability. And reviewing the role of selenium in maintenance the genomic instability, Ferguson et al. Have described that the moderate use of certain selenium compounds in experimental tests, in cell culture, and also in animal and some human experiments may protect against the formation of DNA adducts, chromosomal breaks, and the gain or loss of chromosomes, and consequently reducing the mutations that could contribute to carcinogenesis. Moreover, low levels of selenium are eventually associated with a poor blood glucose control and the multiple type 2 complications. Selenium can be obtained from the diet both in its organic and inorganic form. And these are some examples of food that are sources of selenium. However, the selenium content is relatively low. So a large amount of these foods should be consumed to achieve the optimal levels of these micronutrients. Actually, the higher dietary source of selenium known in nature is the Brazil nut. The Brazil nut have some importance related to their content, but especially for the selenium content that ranges from 80 to 83 milligrams of selenium per gram of nut. And it is also recognized for its high nutritional value due to its high lipid content, that is around 50 to 70%, but also contains proteins and carbohydrates. And it is also rich in other bioactive compounds like essential fat acids, methionine and cysteine, vitamins, phenolic compounds, fibers, and some minerals like zinc, potassium, and especially selenium. Well, knowing all of this, we decide to do an intervention. And first we start with the selection of the participants in accordance with the inclusion criteria from access the medical records stored in the integrated clinics at UNESCO. All of these subjects gave us their written informed consent. And in the first blood sample collection, 127 subjects appear. At the end of the intervention for the second blood sample collection, just 107 subjects had appeared, but applying the exclusion criteria, and that should be attended the two collections, consumed correctly the Brazil nuts, and did not present any health alteration during this period, we remain with 74 subjects. And it's important to say that all participants in this study had stable body weight, eating habits, and constant physical activity levels for at least 4 weeks prior to the start of the study, and that all treatments that were adopted prior to the study beginning were maintained. For example, all the participants used insulin, metformin, and statin daily. The experimental design was based in 2 different collections that were taken immediately before the intervention at the end, 6 months after the supplementation of the Brazil nut. The patients received 1 nut per day during these 6 months, Each nut provides around 200 milligrams of selenium, and every 30 days, 30 nuts were supplied to each participant, and the nuts were organic and originating from the region of Amazon. And after this, we do some analysis related to anthropometric evaluations, height and body weight to calculate the body mass index. We also do some biochemical analysis related to selenium levels of the parameters related to glucose homeostasis, also analysis related to oxidative stress, and related to genotoxicity and mutagenicity analyzed with the COMET assay in both versions, and the micronucleus test in buccal cells. Well, starting the results, here we can see the demographic and anthropometric characteristics of the subjects. 37 were men, aged 61 years old, with body mass index around 30. The other 37 were female, aged 66 years, and with body mass index around 33. When we analyze the results in the baseline and after the 6 months of the intervention, we can see that the body mass index and the weight not changing. And with the intention to prove the efficacy of the nut consumption and the supplementation as a dietary source of selenium, selenium levels were analyzed in the serum of these patients before and after the intervention, and we can see a significant increase in the levels before and after the supplementation. And at the beginning of the study, just 5 subjects had adequate levels of selenium. And at the end, with the exception of only 2 subjects, all the others achieved the recommended levels of selenium. We know that there is a U-shaped association between selenium levels and type 2 diabetes, where low and high levels of selenium could be a risk factor of type 2 diabetes. So the selenium supplementation may benefit subjects with low levels of this mineral. And it's important to say that almost all participants of this study had selenium deficiency at the beginning of the study, and that the tolerable upper intake levels were respected. And also that no clinical characteristics of selenosis in nails and hair were observed in participants of this study. But the maintenance of selenium levels was not accompanied by improvement in the glucose homeostasis. Actually, both fasting glucose and fasting insulin increased significantly after the 6 months of intervention, but not showing a significant correlation between the levels of selenium and both parameters. With these 2 results, we could calculate the quick value, and the quick value is a parameter that's used to analyze the insulin sensitivity. And we could see that there is no difference between the baseline and at the end of the intervention. And more, it is known that fasting glucose and insulin should not be used alone for clinical evaluation. So we also analyze the glycate hemoglobin. That is a marker that is used to verify the glucose variations of the last 3 or 4 months. And we can see that once again, the values were not modified. Regarding the production of oxidants, we evaluated the oxidation levels of DCF and nitrate content. And the results revealed a significant reduction of DCF levels, as well as the nitrate content, and also with positive correlations, suggesting a reduction in the ROS pool. In relation to the antioxidant defenses, we can observe that the 6-month Brazil nut consumption proved to be enough to significantly increase the GSH levels and the GPX and catalase activity, improve the antioxidant system of patients, also showing a positive correlation between selenium serum levels and the markers of antioxidant status. And in this study, we also analyzed the damage to some macromolecules, and here are the results related to proteins and lipids. And we can see that we had good results since the sulfhydryl levels are enhanced, and the carbonyl levels are decreased in relation to damage to proteins. And in relation to the lipid damage, when comparing MDA values before and after the intervention of Brazil nut, a significant reduction in lipid peroxidation was observed at the end of the study. However, significant correlations were only observed in relation to the sulfhydryl and MDA groups. And now here are the results related to the analysis with the COMET assay. We performed both versions, the alkaline and also the FPG version. And we can observe here that the ingestion of selenium through Brazil nut showed an antigenotoxic potential in the alkaline version, and also a reduction in the oxidative DNA damage assessed through the COMET assay modified with FPG enzyme. And both parameters were also present a positive correlation in relation to the serum selenium levels, showing that as higher the amount of selenium, as lower the DNA damage. And regarding the evaluation of the mutagenicity, we used the exfoliated buccal cells. And initially, in relation to cell types, no significant difference were found. But on the other hand, the number of binucleated cells and cells with condensed chromatin were reduced after 6 months of nut consumption, and also decreased the frequency of nuclear buds and cells with micronuclei. And here we can see a significant correlation between selenium levels and micronuclei frequency. So the results of the present study demonstrate that diabetic patients with low levels of selenium can benefit from daily consumption of Brazil nuts, since it improves the antioxidant status, reduces the production of oxidant, and reduces oxidative damage to proteins, lipids, and DNA. So, showing for the first time the potential antigenotoxic and antimutagenic effects of Brazil nut consumption by reducing DNA fragmentation and micronucleus frequency that are observed in type 2 diabetes. And just to finish, it's important to say that micronutrient supplementation should not be a routine practice, because it needs to be individualized and through its real deficiency. Well, studies like this are only possible because we have a great team in the lab. So I have to say a huge thank for all my students that are very partners in these and in other projects, and especially in this study to Dr. Tamiris Pavey, because these results are related to her PhD thesis. And at last, but not least, I need to thank the person that is responsible for me stay here today, for had put me in touch with the Age Comet family, and for having received Tamiris in his lab to carry out parts of this analysis, my dear friend, Dr. João Paulo Teixeira. And I'd also to thank the Age Comet family. As Boiana said, we spent productive but also funny time together in the last 5 years. Thank you.
Okay, we have some questions. Nice presentation, yeah, Vanessa. The practice of physical experience is a factor known to change some of the oxidative stress parameters that you've studied. Did you include this covariate in your analysis?
Yes, in this case, all these people don't practice exercise. Yes, it could be a variate, but our subjects are almost of them retired. If you remember the age, they are a little bit older. Some of them are around 80. Our mean age was around 60, 66 years. And it was a condition actually for the exclusion criteria. They didn't change their habits before the last 1 or 2 months and during all the interventions. But yes, Anna, it could be a variate.
Can I ask what would be some ideal levels of selenium? I mean, individual ones. Do you have some interval or?
Like the interval that is adequate for the
for
selenium.
Selenium, yes. What would be some levels that?
Yes, according to the World Health Organization, the good levels are around 40 to 200 milligrams per day. But the upper intake level, like security, is 400. That could be the upper intake. But okay. The WHO, it's related to 40 to 200 milligrams.
Okay. We have another question from Anya. I wonder if there are daily limits for Brazil nuts consumption in regard to the risk of selenosis development.
Yes, but also it depends the quality of the nuts, Anya, because, for us, found a nut with a good amount of selenium that we could gave for them just 1 nut per day. We bought some different nuts for different places in Brazil until found one with a good amount of selenium. Brazil is a very huge country with different places where the Brazil nut could be planted, could be cropped, and because this it's not easy, and because also again because this we are always saying that it's okay to eat, but moderate, and especially if you intend to eat with to change the levels, what with the intention to benefit health benefits, you need to check your selenium levels, especially because in the soil we have different places in Brazil where we have more or less selenium in the ground. So also other kinds of fruits or vegetables could also have some selenium in amounts.
Also, I guess before the study, you actually check the selenium content in different types of Brazilian nuts to choose the right
we
one.
bought, I think we bought 4 different lots of nuts until found these that is actually organic, certificated, and used to be exported. This place where we bought the nuts used to export.
Yes, sorry, I cannot use my keyboard right now. So congratulations, Vanessa, for your presentation and for this huge study. Some years ago, we conducted an in vitro study demonstrated that the selenium methionine improves the DNA repair capacity. So are you planning to do this in these individuals? So to evaluate if the consumption of Brazil nuts is really improving their DNA repair capacity?
Thank you, Blanca. Yes, actually, we did another work, what I didn't show today, related to the hydrogen peroxide challenge with diabetic patients that had received this. And just related to this kind of analysis, we also could analyze that the DNA repair capacity of these patients in that ex vivo experiment improved. But answering Sabine, because Sabine also, I think she wrote in the chat, actually the version of the COMET essay with DNA repair, actually we didn't do, because until now we don't work with this modification of the COMET, but for sure I'd like to do.
I have one more question, more of a curiosity, since Brazil is probably an Amazonian region full of different potentially medicinal plants. Is something else currently in your focus, or do you have some other potential medicinal plants that you're working with?
With humans, we just do interventions with vitamin D, and now with this. But with animal models of obesity, we evaluated the, I don't know, it's a typical Brazilian fruit we call acerola. In English, I don't know the name. I know there is a name. Yes, because it's a fruit that is rich in vitamin C and also rutin and quercetin, and it's very common here in Brazil. And we published some papers related to this in relation to obesity, but in animal models. And now we are more focused on nutraceutical compounds. We have some studies in the lab with omega, with vitamin D again, and melatonin.
Okay, so your lab is quite busy.
Yes, Barbados cherry. Someone wrote here.
Yeah, let me see. We have a comment. Okay, acerola Barbados cherry. Okay, thank you.
Yeah, it's a cherry, but it's not like your cherries in Europe.
Okay,
it's orange. It's orange, almost red, not like dark, like the blue ones.
Okay, thank you, Vanessa, for this interesting talk and for answering all of our questions. Well, and with this, I would like to finish the first ECOG symposium. Thank you all for attending both days. We had more than 200 participants each day, so I think we were very successful, and hopefully we will have another symposium in due course, and hopefully this one will be face-to-face. So you can become our member, as I said at the beginning, and you can follow us and our webpage and even social media to stay up to date with what we are doing and what are our future plans. So thank you once more.